Gonorrhea, a sexually transmitted infection that affects millions of people worldwide. Did you know that according to World Health Organization, gonorrhea is estimated to infect over 87 million people globally each year? In the United States alone, there were approximately 550,000 reported cases of gonorrhea in 2019. Despite the availability of effective treatment, gonorrhea remains a public health concern in many parts of the world, with the highest rates found amongst young people aged between 15 to 24 years. So in this episode, let's challenge ourselves to have an open mind and consider the importance of education and awareness around gonorrhea, not just for ourselves, but for our communities as well. Let's get started. To begin with, let's look into its history. Gonorrhea can be traced back to the earliest records of human race. The Romans, Jews, and Arabs all have documents referring to gonorrhea, and each society had their own description of symptoms and treatment. The Roman physician Galen in 130 AD described the disease as an involuntary escape of semen. Gonorrhea was termed strangury by Hippocrates in 460 BC. Who claimed that it resulted from the pleasures of Venus. The disease was also referred to as the clap, referring to the clapping sensation experienced by the infected person during urination. Throughout the history, wars were also associated with outbreaks of STIs. Historical evidence suggests that Roman soldiers fighting with Julius Caesar in 100 BC suffered from gonorrhea. STIs, including gonorrhea, had caused many deaths during the Crimean War as well in 1854 AD. It was in 1879 that a German physician named Albert Ludwig Sigismund Neisser, who discovered the causative organism of gonorrhea as Neisseria gonorrhea, a strain of bacteria which was named in his honor. His results were published in 1882. Today, gonorrhea is currently the second most commonly notifiable sexually transmitted infection, second only to chlamydia infection. Now, let's talk about how gonorrhea is spread. Gonorrhea is easily passed between people through unprotected vaginal, oral, or anal sex, sharing vibrators or sex toys that have not been washed or covered with a new condom each time they're used. And this infection can also be passed from a pregnant woman to her baby. If you're pregnant and may have gonorrhea, it's important to get tested and treated before your baby is born. Without treatment, gonorrhea can cause permanent blindness in a newborn baby. However, gonorrhea is not spread by kissing, hugging, swimming pools, toilet seats, or sharing baths, towels, cups, plates, or cutlery. This is because the bacteria cannot survive outside the human body for a long period of time. Let's now discuss the symptoms of gonorrhea. It's important to note that gonorrhea can sometimes be asymptomatic, meaning that it may not cause any noticeable symptoms in some people. When symptoms do occur, they can vary depending on the site of infection. In men, symptoms may include a discharge from the penis, pain or discomfort while urinating, and swollen testicles. In women, symptoms may include abnormal vaginal discharge, pain or discomfort while urinating, and pelvic pain. Both men and women may also experience rectal gonorrhea if they engage in anal sex, which can cause rectal discharge, pain, and discomfort. Let's now look into the testing and diagnosis of gonorrhea. If you suspect that you may have been exposed to gonorrhea or are experiencing symptoms, it's important to seek medical care promptly. A healthcare provider can perform a physical examination and order tests such as a urine test or a swab from the affected area to confirm the presence of the infection. It's important to be honest with your healthcare provider about your sexual history and any symptoms you may be experiencing to ensure an accurate diagnosis. Now, let's discuss the treatment options for gonorrhea. Gonorrhea is usually treated with antibiotics. Antibiotics are usually recommended. In most cases, treatment involves having an antibiotic injection, usually in the buttocks or the thighs. It's sometimes possible to have an antibiotic in a tablet form instead of an injection if you prefer. If you have any symptoms of gonorrhea, these will usually improve within days of starting antibiotics, although it may take up to 2 weeks for any pain in your pelvis or testicles to disappear completely. For women, bleeding between periods or heavy periods should improve by the time of your next period. Attending a follow-up appointment a week or 2 after the treatment is usually recommended, so that another test can be carried out to see if you're clear of the infection. One concerning fact about gonorrhea is the increasing rate of antibiotic resistance. Over time, the bacteria that causes gonorrhea have developed resistance to many of the antibiotics used to treat the infection, making it more difficult to effectively treat and control the spread of the disease. Finally, let's talk about the prevention measures of gonorrhea. The best way to prevent gonorrhea and other sexually transmitted infections is to practice safe sex. This includes using condoms consistently and correctly. If you are being treated for gonorrhea, you should avoid having sex until you and your partner have been fully treated and given the all clear to prevent reinfection or passing the infection on to anyone else.
Thanks for tuning in, everyone. Please like and share this video and subscribe to our channel. Together, let's build a world where sex education is a human right.